Virus right now is more dangerous than it has ever been across the world. We have to make sure that we all follow the rules. We all need to take this seriously.
A warning against complacency as COVID threatens Sydney again. Following yesterday's positive test from a limousine driver and his wife, today another confirmed case. A woman in her 70s who attended an eastern suburbs cafe at the same time as the driver.
We consider all people who were at that Bell cafe at the same time as the driver to be close contacts, and they must all be tested and isolate for 14 days after their visit.
The limousine driver had been transporting international flight crews but hadn't been vaccinated. Police are investigating whether he breached COVID safety rules, which include daily COVID tests and wearing appropriate PPE.
All workers, all drivers within the quarantine system have very strict obligations which are covered in our health orders. And if there's been any breach of that compliance, the police will advise us of that.
It was a very different mood down south. Victoria, carefully emerging from lockdown, today celebrated no new community transmissions. But there are frustrations over a previously reported case, a nurse who worked at 2 different hospitals.
I'm exceptionally concerned. There's a provision that says if staff are working in a COVID ward with positive patients in the ward, that then staff are not working across multiple sites. That should not have been allowed.
Despite Victoria's apparent success in getting its latest outbreak under control, Queensland has extended its ban on Melbourne travellers right up to the start of school holidays.
In line with other jurisdictions, we will maintain our restrictions on travel from Greater Melbourne for another 7 days.
No such restrictions on New South Wales from the Sunshine State just yet, but South Australia has banned entry to anyone who's been in a high-risk location, as officials keep a vigilant but nervous eye on the outbreak.
Epidemiologist Professor Tony Blakely joins us once more. Tony, let's start with New South Wales in that first case. Is it acceptable, really, to have unvaccinated drivers ferrying around international flight crews?
No. The answer's that simple. Why it happened remains to be seen, whether it was the driver not complying or his employer wasn't enforcing it. But this is a real slip-up. And the virus will just take advantage of our slip-ups and find its way out. So this should not be happening, and that ring around the people coming into the country and around our border, everybody should be vaccinated with Pfizer. It reduces the chance of them getting it and passing it on by 20-fold, so that you would have been much less likely that this would have happened.
Tony, up until now, most of Australia hasn't had experience with this Delta variant. How does this affect the way Sydney should be responding?
Look, I actually find this quite concerning. Just in the last 2 days, we've been working our models, calibrating them really hard to approximate what used to happen last year with places like New South Wales, where 90% of the time they get on top of an outbreak with just the contact tracing, the New South Wales success story. But when we pivot to Delta, which has twice as infectious, we only see that contact tracing working about half or a bit more times. So I hope that New South Wales gets on top of this contact tracing, and all power to their contact tracing workforce. But I think New South Wales people and the population of Australia need to realise we are dealing with a much more infectious virus now, and I fear that we're going to see more quite serious, even quite big outbreaks, and certainly more lockdown between now and when we get our vaccination coverage right up.
Professor, that is quite concerning. How different is the Sydney situation compared to the one Victoria is emerging from?
Yeah, there are a few differences, and the key one that strikes me is that when we had the Delta pop up here at the same time as the Kappa, fortunately for us, Delta happened to have an outbreak when we were already in lockdown, which was quite fortuitous. The fact that this Delta has popped up in Sydney, where there were no restrictions, and you've got the people in the limousine, so somebody gave it to the driver, they may have given it to other people, the driver may have given it to quite a few more people, and they may have given it to more people because it's very infectious. It is quite concerning. As I've just said, I really hope that New South Wales can bring this under control with their contact tracing, but everybody needs to understand that this is a much tougher gig now than it was last year.
The other big news today, Tony, is the federal government now advising the AstraZeneca vaccine only be given to over 60s. How do you think this will affect the rollout?
Well, it's really on the one hand, on the other hand. On the one hand, for the 50 to 59-year-olds who were reluctant to get AstraZeneca, they've now got an open door to get vaccinated, so that's good. But we don't have a lot of supply of Pfizer and Moderna, although it is kicking up over time, to actually fill that need. I think it will do good for vaccine uptake in the long run, say by Christmas time, but I'm really concerned about the next couple of months with Delta being around. If we do see a big outbreak, and I mean bigger than what happened in Melbourne last year, if we see a big outbreak, we will see people getting AstraZeneca down to 40 or so. So we may well move it up and down from here on. But I get the reason why now, and it's probably a good move in the long run, but I'm very nervous about the next couple of months.
Well, Tony, this is becoming a weekly check-in, I'm afraid, but good to have you available to us. We appreciate your time.
I hope it was useful.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.